Good morning, everybody. This is Tom and Megan with Benefit Administration Group. We are doing a re-recording of our webinar on telemedicine, which we just did earlier this morning with a live audience. No audience this time, but we're going to try to make it tight for people to review as they're able. The reason that we're doing this webinar today is that the carriers, the insurance carriers that we work with and we work with our clients for, are now really starting to kind of embrace and push the whole concept of telemedicine. It's become just another feature of most of the benefit plans that we offer and help clients buy. So we're just trying to make sure everybody understands what that is, where it fits in the whole platform of options for people in seeking care, and when it's appropriate and inappropriate, advantages, disadvantages, that kind of thing. Megan did most of the heavy lifting on all of this. So I'm going to let her take point on this, and I'm going to interject as appropriate. So why don't you go ahead and kick us off, Megan?
All right. So to start out, we're just going to talk about why potentially telehealth is on the rise. Just that graphic over there shows you the large amount of growth we've had in this industry since 2013 to 2018, which really shows no sign of stopping these days. Just like anything else, technology and being able to do things easily and remotely is becoming more and more popular. Some of the advantages we're going to talk about as to why it's advantageous to an employer kind of to have employee participation in telemedicine is based on really, it depends on the amount of usage the employees are getting out of it. So in order to see these benefits, you're going to need some participation from your employee population. The first and most obvious advantage is that it saves money. There's been kind of the options when you're having a medical issue have been to see your primary care physician, to go to the urgent care, or to go to the emergency room. Urgent cares have kind of taken over in lieu of the emergency room due to the fact that they're less inexpensive, more convenient, and less wait time. But the copays you're going to see at the urgent care, whether or deductible expense, either one you face, is going to be higher than your cost to use a telemedicine service. So it saves money. It saves the employees money first and foremost. It can save them time being out of the office if they're not going to an urgent care or a doctor office, and that could potentially improve the productivity. And it also can lower your claims expense with a lower medical expense. If you're a large group employer and you're looking at being experience rated, if you're in that boat, or if you're a smaller employer who just is looking into other options such as self-funded or level-funded premium, a lower claims experience can help you out in those departments. It's clearly convenient, and it can increase preventative health by people who are sitting on an issue wondering whether they really want to go and see somebody about it, or just it's much more convenient to just call it in or video chat it into a teledoc.
But just like we saw, the urgent care phenomena kind of take hold, and that represented a change in the way people were doing things, in that they had an option now for an emergency room to go to this new urgent care concept, and similar reasons why they would want to go to an urgent care over an emergency room exist now in comparing urgent care and telemedicine. And it's all about knowledge and awareness. So, in order to get these benefits of reduced cost and efficiencies and convenience and things like this, employees need to know that they have access to it. So that's why we're doing this here. To quantify that a little bit further, Megan got these couple of slides just comparing the costs.
Yeah, so that first graphic there can be a little tricky. Those 7.9 times, 15.1 times, that is the expense of the cost. It's that much more to go to the ER. So going to the ER for potentially preventable conditions is 7.9 times the average cost of seeing a doctor, 15.1 times the average cost of using telemedicine, and 3.5 times the cost of the urgent care, showing that telemedicine is the most costly.
Or the least costly.
Yeah, that one.
Relative to these others.
And then the other graphic just kind of puts some real dollars there on average for 3 typical illnesses we'll see, and what it would cost for you to go to the emergency room, urgent care, or office visit. And this doesn't include a telemedicine column, but if it did out there, the average copay price we're seeing on a telemedicine call is about $40. Specifically in the Blue Care, which is associated with Blue Cross and Blue Shield, it's $39 capped. So that's the maximum you would pay. It's possible to get a refund back from some of that money.
So you must be sitting there wondering by now, well, with all of these advantages,
what could go wrong?
What could go wrong? Well, what concerns do you have about these kinds of moves from urgent care, emergency room to a telemedicine?
Okay, so the first one is reduced care continuity. And what that means is whenever you log on to one of these telemedicine platforms, you're going to pick a doctor that's available at the time. And it may not be the last telemedicine doctor you've seen. It definitely won't be your primary care physician who knows what's been going on with you for a while. So there's a chance that without previous information from medical issues or concerns, they aren't going to have the best diagnosis for you coming up. The second one, which comes with any kind of new use of technology, is equipment and technical training issues. If you have new physicians just getting into the telemedicine business, they might have technical issues, they're going to be needed trained on the system.
Users might have problems using the technology.
Yeah, not only physicians, but users are going to need access to
smartphones,
something they can use, and video technology as well. And worries about fewer in-person consultations. There are some diagnoses that are best in person, that you need to physically see them, and you're going to have your internet connectivity issues going out on you. You might lose contact with a doctor in the middle of a visit and be forced into another one to repeat your story.
Correct, yeah. As a matter of fact, why we're doing a re-recording here is we had, during our big live session, we had our PowerPoint went down briefly. So obviously that's not a life or death situation when we're talking about doing a presentation, but and hopefully it's not a life or death situation in a telehealth visit, because that's not why you'd be on a telehealth call. But it is something where that would break it up, and if you had time set aside to do something and all of a sudden you have a technical glitch, you're going to be kind of starting over again, and that frustrates some people more than it does others, and it's a difference, and it's something to just be aware of, we think. But there's really no denying this trend, unfortunately. I was shocked when Meghann pulled this stat and threw it out there, just at the sheer volume of it. But it's showing that $17.8 billion moved between patients and telemedicine companies.
Yep.
That's a ton of money, and they're saying that they're expecting an 18% growth until the year 2020, which is a large growth percentage on a very large starting point number. So. And that's kind of got a few years under the bridge now to where they can kind of see this trend emerging. But Meghann was able to find that and source it down there at the bottom.
Okay, so the next thing we're going to talk about is just how to get the best use for telemedicine, because obviously not every medical issue is going to be great for it. In fact, they recommend that for chronic conditions or ongoing treatment, it's not really the best outlet. But for your regular sinus infections, cough, cold, rashes, allergies, things like that, it's really useful. And there's also been showing good success in mental health departments. Just some quick specifics on the graphic. I did mention earlier that Blue Care specifically is $39 a pop for a telemedicine visit, and it's also available 24/7, which is pretty darn convenient.
We did put a little quick video here. It's about a minute long. America Well Patient is the entity that Blue Cross is using to provide their telemedicine. So that's not uncommon for insurance companies to partner with other entities to provide a whole host of services. But this is the entity that both Blue Cross and United Healthcare on one of their networks is using. And then there's some others that we're going to get to in the next slide. But we have just a minute-long video here that I think puts a few visuals to this concept that we've been talking about real quickly here.
With Amwell, healthcare has never been easier. Now you can talk with a healthcare provider from wherever you are, through video or by phone. Welcome to Amwell. How can I help you? First, you're going to enroll or log into your account and choose the type of visit you want. Select the healthcare provider you would like to see. If your insurance or employer covers your telehealth visits, type in your information and you may receive a lower cost visit. Select what you would like to talk to your doctor about and start your live video visit. Not only does Amwell offer a broad range of services, but it is the first telehealth service to offer a multi-way feature, which allows you to easily invite additional participants. A before or even during your video visit. Not ready for a live video visit? You can schedule a visit with some providers with the newly released self-scheduling feature. At the end of your visit, email your visit summary to your primary care provider or a family member. Trusted by families nationwide, Amwell brings healthcare to you on your terms. Visit Amwell.com to learn more.
Okay, so a little commercial for Amwell there. Some things of note, I think, there that are slight differentiators as we exist today is that whole like video conferencing multiple people in, and I think most of them will allow you to forward the information or the summary of what happened in a telemedicine visit to your primary care doctor, which can hopefully help with some of those continuity issues that we were talking about and awareness, and or other family members. So, we have people potentially taking care of a parent or a sick child that would need to be in the loop on these kinds of conversations. So they have the technology to do that. And I imagine that that's just going to get better and better and better over time. But Meghann did an awesome job of going out and kind of finding all the players in this space. I believe Teladoc was kind of the first player real of significance to kind of pop on the scene. They are actually who Aetna uses.
Correct.
As their telemedicine provider. United Healthcare and Humana, United Healthcare and Blue Cross use Amwell, the one that we just talked to. And then Humana has something that looks like it might be self-provided or at least white labeled to where we're not exactly sure who it is behind the scenes yet, but they're talking it up. And then there's some standalone providers of telemedicine services as well. So we painted some broad brush kind of strokes on this thing, and from our perspective, we're usually involved with our clients on their annual open enrollments and communicating benefit information to them. So this is just for us right alongside of educating people on the different copays for their formularies, or for the different copays associated with urgent care visits, or how to figure out where your doctor is in network. It's just another service that's part of the benefit package that people, will only use if they know about it. And so from our standpoint, if we're going to make sure that our employer clients know about this, and we're going to make sure that they're okay with us weaving this conversation into our annual open enrollment visits. And then also, most of our clients know that we use some online technology to do all of the paperwork side. We're completely paperless in the way we handle enrollments, ongoing and open enrollments. So we can weave some of this information into that online platform as well, so that we have easy access to information and instructions, and then some of the collateral marketing materials available. So that is the gist. I think we got pretty tight on that. Again, like I said, if you have any questions about this, please don't hesitate to reach out to us, and we're happy to help you either put this in place or get the word out to your employees. But thank you very much.